Monday, November 9th, Board of Health meeting. I have a little paragraph. I shouldn't say little. It's a big paragraph I have to read first. Pursuant to Governor Baker's March 12th order suspending certain provisions of the open meeting law and the governor's March 15th, 2020 order imposing strict limitation on the number of people that may gather in one place, this meeting of the Southborough Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines of remote participation by members of the public and or parties with the right and or requirement to attend the meeting can be found on the Town of Southborough website. For this meeting, members of the public who wish to watch or participate in the meeting may do so in the following manner by finding the meeting at the southborough.com/remote meetings link. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technical means. In the event that we are unable to do so, despite best efforts, we will post on the Southborough's website an audio and or video recording, transcript and or comprehensive record of the proceedings as soon as possible after the meeting. Phew. So we got through that. Dan sent an email saying that he was going to try to join, but to go ahead and proceed. So Dean might join at somewhere in the course of the meeting. But to get started, Paul, can you give us an overview of today's meeting?
Did we lose him again?
Yes, we did.
I guess I'm not in the picture.
No. Okay, we got him
Oh,
now.
here you come, Paul. You're coming.
I lose him.
Anyway, you all have a copy of the agenda?
We can't hear you, Paul.
Yes.
Do you all have a copy of the agenda?
Yes.
Okay. I guess I'm just two white blobs on the picture that I have of myself, but that's
That's what I see as well.
I don't know what happened. Anyway, we have several items that we need to have discussion about and a few that we need a vote on. And we hopefully will get through this if I can be short-winded and especially on the votes that are going to be needed. But there are a couple of reports that I would like to make if I have the opportunity. But the first thing I wanted to we put on the agenda was the discussion of some of the additional public health nursing needs, because that seems to be a issue that Emily is try to cope with the extra hours that she's been putting in. And as you know, she has a per diem nurse helping her, but she can report on that. The other thing is we have the draft Board of Health budget, which you may have gotten a copy of, and it's in a new format, which the town is using. Barbara has utilized it, and it's called ClearGov. And I'm not sure, because you can't see me, I guess I can't show you pictures of it, but we get into discussion of that budget. It's a draft budget, and I found out about a half hour before this meeting that Brian Ballantyne would like to have at least one Board of Health member present with me, which is great. I like that idea, rather than me presenting the budget. But we want to make sure that everybody realizes it is a draft budget at this time, and I can get into discussion of that, what it consists of, and so forth.
When is the budget meeting, Paul?
Sorry, what?
When is the budget meeting with Brian Ballantyne that you were just saying?
It was scheduled for tomorrow, Tuesday, at 11 a.m.
But he wants a board member with him. If a board member cannot attend, it will be rescheduled.
I'm working. So Mary Lou, you're going to go?
I can't go
No, I think that-
tomorrow. I just told Paul, so Paul's gonna try to reschedule it.
Yeah, because I'm working an endoscopy tomorrow, sorry.
Yeah, I'm working too, so, we'll have to reschedule it.
Okay, so then, so far, we haven't had any rescheduled, other meetings with the Personnel Board or the Finance, Planning Advisory Committee, or the Selectmen. It's only been with Brian Valentine, who heads up the so-called Finance Subcommittee of the town. The other thing is, if we get chance, I want to talk about the Breakneck Hill Davis Farm dump. In the draft report, which I gave to everybody, the board members, and have a vote taken on that as to how we should proceed on submitting that to either the Board of Selectmen and the Conservation Commission and others. I don't know if there are any other issues that may come up. I'm not sure if Sam Stivers may get hooked up to our meeting because he wanted to also bring up some issues relative to the application for waste haulers, which we talked about very briefly at the last meeting. And I've gotten a copy of that application from the town of Westboro, but then I also have a copy of their regulations, which I would like to discuss with you if we get the opportunity this afternoon. So that's it in a nutshell.
Thanks, Paul. It's, there's a lot here, a lot more than some of our previous meetings, so we'll do our best to kind of move along so we can get to all of the items. First on our agenda is approval of our past minutes.
Mhm.
Nancy, did you get those minutes?
I did, yep, I thought they looked great.
Okay, so I'd like to make a motion to approve the minutes of the October 9th meeting.
I second the approval of the October 9th meeting.
Great. And I'd like to make a motion to approve the minutes from the October 21st meeting.
And I would second the approval of the meeting minutes for the 21st of October.
Great.
You need to vote now?
I think you have to actually vote.
Yeah,
So
I think we go through this every time, I know.
I know. So I will make a
Well-
motion to vote to accept the minutes of the October 9th meeting. This is Mary Lou Woodford.
Okay, this is Nancy Sacco, and I also vote yes to approve both meetings minutes.
Let's do I just did the 9th, so let's do the 21st. Like to vote to approve the minutes of the November 21st meeting. Mary Lou Woodford approves.
And this is Nancy Sacco, and I also approve the meeting minutes for the 21st. I vote to approve.
Great. One down. The next on the agenda is our staffing needs and other thoughts. And I don't know, Paul, you want to start that discussion?
Sure. Okay. Well, let's see, what happened to my agenda here? There we go. All right. While we were talking about the fact that we have been in need of additional nursing services, nursing hours, we hired Molly for a per diem nurse, not to exceed 20 hours a week. And I believe, not sure, maybe Emily can report on what additional nursing services or help she needs at the present time and how Molly is working out. And then we can go from there.
Yeah, can either Mary Lou or Paul mute because there's like a feedback? You're in the same office, right? Or in the?
Yeah, yeah.
that help? Because I tried to do that and it still didn't work. I tried to mute and it didn't really work. So maybe I can go into the vaccine room and see if that helps.
Sorry.
No, I was hearing the same thing and aggravated, but I didn't know what to do about it.
I already have a hard time talking on these things, so.
Right. We should be far enough away now.
You can close that door too.
Okay, perfect. All right, that's better.
I think it is.
Doesn't that sound better?
Yes.
Yeah.
Okay, perfect.
So, Molly's been great. She's been having some issues this past couple of weeks that she wasn't able to work as many hours. But I'm still working 50 hours a week consistently. So I really need to have another body, I think, not even just more hours, but like another person. Because if Molly is not available, then, you know, we need to have another person available to be able to do case investigations and contact tracing. And then we're also going to need help from what I'm anticipating for any kind of COVID vaccine clinic in 2021. Hopefully sooner rather than later, but obviously we don't have all the word on that yet. So it's hard for me to predict how many hours because it is really variable. Our cases are down this week, but just with each investigation, there seems to be more and more contacts because people are, you know, involved in their different activities and within 6 feet of people at work and at school and all these sports and things like that. So I just need help. I'm like drowning in 50 hours. I can't maintain that for the sake of myself and my family and my work. I feel like I can't give my best to work either. So.
So Mary Lou, you probably understand what it is she's doing a lot better than I do. I don't really know what's.
Way more than I want to.
Well, I was on a call today with Kitty Mahoney.
So it's very
from
hard for me
Framingham,
to.
and she said that, you know, very quickly at the beginning of all the pandemic, she had 25 nurses working, and, you know, we just had myself and Leslie to start. And then, you know, then it was just me for a while. And then now we've brought on Molly, which has been a great help. But I think that it's still overwhelming. So
It sounds like, would it be feasible if we did another per diem?
yeah, I think so.
So if that person could do similar things that Molly's doing, but then you have, if one's out, then the other one can give you relief and you can expand the hours as needed if there are per diem position versus, you know, a set hour position.
Yeah.
And what
It
are
worked out
other
really well with Molly because she, you know, is relatively flexible and can pick up, you know, calling contacts and cases, and she's gotten the hang of Maven too. So
Okay. Nancy, you had a question.
Yeah, what are other smaller towns doing that, you know, I'm just curious, do we know?
So,
And like
yeah,
this is all stuff that's mandated, so like it has to be done?
correct. And
Okay.
it's very different town to town. I mean, some
Okay.
towns don't have any nursing at all. Some towns.
So what are
have-
they doing? Like,
so
it just,
some towns have contracted with VNAs.
okay.
And so the VNAs are the nurses that are doing the work. Some
And
towns,
who's paying for this? Like,
Well,
have they gone to like the
CARES.
advisory boards and stuff like?
well, the CARES Fund, so is funding most of the COVID investigations at this point. Although we know that that money is going to go away unless it gets refunded, which is still possible, but that's where most of the money comes from at this point.
And so can we use that? Can we
Oh,
access
we have
that?
been. Oh, yeah.
Okay,
Yeah, that's really paying for Molly at this point,
All right.
paying for the extra hours that Emily's putting in at this point.
okay.
And some towns are using the collaborative that was set up through the state government and DPH and partners. And that has its own challenges working with them. And we tried that. Emily tried that at the beginning. We tried it in Framingham, and it ends up being more work because
Yeah.
of the duplications, because of they're not all nurses that are doing the work, so they don't get enough information, and then you have to call them back anyway.
Ugh.
So it hasn't been as helpful. If you're a town
Okay.
with nobody, then that's all they have, so they're doing that. But
Sure.
I guess we feel like we have the ability to do it well, and we want to do it well, and so now it's really supporting Emily, but it's not just the investigations and the tracing. Now that people are getting back to their activities, it's also thinking about, the implementation of a vaccine and what that would entail. That's going to be far more than a flu clinic.
In some of the small towns around us, it's a lot of the health department director, and the nurse working together, doing investigations. I know that happens in Hopkinton and Hudson, for example. And then they also, some towns utilize the school nurses, and there was some problem with us being able to do that, so I don't know.
Right. It was a contract issue with our school nurses. A lot of towns use their school nurses, and the school nurses pick up extra hours after school and on weekends. But I guess I'd like to make a motion for a per diem nurse to provide support to the health department.
Oh, you're muted and you're upside down.
Yeah. There she goes.
He's right side up on my screen.
Yeah.
Yeah,
Oh, there you are.
you kept freezing, Nancy.
I know.
So I just made a motion, so I'll repeat it. This is Mary Lou. I'd like to make a motion for a per diem, an additional per diem nurse to support the health department.
Mary Lou, can somebody, besides waiting for a second on that, also amend it or think about tapping into the two other nurses that we interviewed, so that if in fact the board votes to retain the services of a per diem nurse, we don't have to go through the whole process of a whole set of postings, advertising, and interviewing. We have two other nurses that applied that are, I don't know what their availability is, but I think work out very well. But if we could use that process to utilize to find out which one is available, because we don't have a lot of time. If in fact the CARES Act money completely disappears on December 31st, which it's slated to do,
Right.
That doesn't give us a lot of time to hire a per diem nurse to help Emily.
Yeah, I mean, I would think they're going to have to come up with more money, because they can't expect, people to be working 100 hours a week. So
I agree.
And Nancy, when we met with the selectmen, the selectmen said they would advocate with our state legislators
Oh, good. Okay.
for those additional funding, whether it be, both the House and the Senate,
Oh, wonderful.
reaching out to those legislators, realizing that, towns need that additional support going forward. I think when the CARES Act went in place, there was thinking that we wouldn't need it after December 31st. Now it's clear that all the towns need to continue this work for a period of time. So they're going to advocate for it as well. But at least in the meantime, we can hopefully get some support for Emily.
Absolutely.
Okay, so do you second my motion?
I do. I don't know if it probably didn't go through, but I do second the motion for another per diem nurse or two.
Okay, and so I'm gonna vote. I'm gonna take a vote. This is Mary Lou Woodford. I'd like to vote to approve an additional per diem public health nurse.
And I vote as the same as Mary Lou for a more per diem nursing help for Emily and the town.
Could you either take another vote or
Oh God, I don't
add on
know.
to that vote to try to utilize the 2 nurses that we've already interviewed?
I don't think so, Paul. That's just a process issue. I think we should be fine on that. I don't think
Because
need-
we don't know how many hours each can do. We
No, I
might
know,
need both of
but
them. We might just
I-
need one. We don't
I
even
just
know
have
if they're
fear,
available.
I have a lot of fear and trepidation that we will get to the point where, okay, we're ready to hire somebody and now we have to post it and advertise and then go out to bid, not to bid, but interviews and so forth. That's going to take 2 to 3 weeks.
All right, so I'll make a motion to utilize the past posting to hire nurses who went through that process first before posting if needed.
I second the motion and also vote to approve the motion to use the 2 previous, previous postings for the job applicants. Yeah.
And this is Mary Lou, and I vote to approve hiring one of the candidates from the last posting, if at all possible. Because we need to expedite this as soon as possible.
Amen.
Thank you.
We're trying, Emily, do you have any updates on either the COVID vaccine or flu vaccines, or sort of what's been going on, with that since our last? I know you talked at the selectmen's meeting, but maybe you can give a little update here for everybody.
So we actually had a pretty robust flu clinic season. We had 3 successful clinics. I don't have the numbers in front of me of how many people we ended up vaccinating, but we still have some vaccine left. So we are going to put it out there to the community and to the employees of the town that we still can vaccinate. We probably have about 90 doses left. And I know the school would like to have another clinic if possible, but first I want to see who's left in the town and for just general residents.
And that's the quadrivalent, no more high dose, correct?
We have high dose. Yep. We have
You
20.
do?
Yep. We have 20 doses of high dose. We have the flu block. We have 21 doses of flu block, 20 doses of high dose, and 50 doses of quadrivalent.
Great.
And then we actually still have 10 doses of the state issued pediatric doses. So we still have quite a bit. And I think there is going to be a need in the schools for sure. But
so can people make appointments with you? Like okay.
Yep. So Barbara and I talked about appointments for the days that I'm for sure in the office, which I think we're going to do Monday and Thursday between 10 and 1.
Okay.
To have people come in, and Vanessa Hale was going to also put it out to at least to the staff. So, and then maybe we can get it on social media. I did talk to one of the public health nurses, Casey Morrow in Hopkinton, and she was excited that I had high dose. So she may be letting her people know too. So we got to get it out there to our people.
Sounds good.
As far as the COVID vaccine, we don't have a plan yet. It hasn't come down from DPH, but it's still on track to hopefully get emergency use authorization and be able to be dispensed. So we'll see. More to come soon, hopefully.
Did you ever get a copy of the state plan, Emily? I haven't seen it yet.
No, it is online though.
Oh, great. Okay.
Yeah, it's on the mass.gov.
I'll look at that.
I'll look it up now and I can send you the link.
Okay, super. So next item on the agenda is the budget.
Okay. So I have drafted a budget for the board to consider, and this is the budget I'm going to speak to Brian Ballantyne about. Current budget that we are in right now, the fiscal year we're in right now, is $171,167 per year. I am proposing a budget of $349,320 per year. It's almost doubled. It's a little more than doubled. What I'm proposing is that the board hire a new full-time public health director, a grade 8 in the salary administration plan, a full-time business administrative person. That's what Barbara does right now, but this would be a full-time grade 5 business administrative person. From the current, she's currently 24 hours per week. This would go up to 40 hours per week. And then the part-time salaries would be a nurse, Amelia Miko, at 19.5 hours per week. Another nurse at 19.5 hours per week. Special project continuity agent. I'm recommending that my position be relegated or diminished, if you will, to just being used for special projects and for continuity of projects that have been ongoing for the last 20, 30 years I've been working for the board. And then a public health consultant at $20,000 a year. And temporary services would be a new per diem nurse. And then the contracted services would be sanitary inspector Dennis Costello. Now, that budget is a draft presented to you, and I would like to have you consider maybe taking a vote to at least could pursue it as a draft and maybe go over it with me individually or with yourself individually, looking at it and asking questions about it. And then hopefully we'll get myself and Mary Lou at least to present this before the Finance Committee, which is composed of Brian Ballantyne and the Town Administrator Mark Purple, and usually a few other people. So that's my recommendation.
I thought we were going to advocate for a full-time nurse and then potentially go down to 2 part-time. I don't know. I thought that's what we had talked about.
We did talk about that. You're absolutely right. We did talk about a full-time nurse. We could put that in. I would like to have a full-time nurse, and then
So like one and
Emily.
so are you saying, so 1.5 FTE nurses?
Right.
As
I
opposed-
think it's a full-time job.
No, I think we all agree, Emily, especially if we're going to try to move to accreditation and all of the other public health activities that we just haven't had the ability to do. But I guess the question is it multiple people part-time? To me, it would make more sense to have a full-time person and then a part-time person to support that person.
So is the reason he did 219.5 is because of the benefits, correct? Then they're, because,
They can't go above 19.5 or they become
Right.
full-time.
Right.
Correct.
so that's
that-
what you were trying to avoid, Paul, is having the benefited?
Yeah, that's what I was
Yeah.
trying to avoid, but I would prefer to have the board overrule me and override what I'm suggesting, because again, I know when I go before this committee and with the advisory and so forth, they don't like the prospect of hiring full-time people because of the benefits.
Right. But I mean, I think given the pandemic and the fact that there's no end to it anytime soon. I mean, I know we have a vaccine, but there's still going to be a lot the next year or so.
Mhm.
I think this is the year we should try to get a full-time nurse.
So
I think if we're going to get the support at any point, this would be the year to try for it.
Okay.
And
Because
Paul,
we can track all of
cannot-
Emily's hours. I mean, if she's working 50 hours a week and we get up at town meeting and defend our budget saying, look at, I mean, this is ridiculous.
Mhm.
Well, 50 hours is just how many I can work. Like I go to bed every night
Right,
saying,
exactly.
oh my God, I should have done that. I should do this. I need to do more. Like,
And I think
I
we
mean,
could
that
make
has to
it,
do with the pandemic too, but
yeah, I think a lot has to do with the pandemic. And I think we should probably use that to our, not to our advantage. There's nothing good about the pandemic, but I mean, I think people hearing that and we're more apt to get a little more support because it has been a lot of the case investigation and the contact tracing and all that stuff, which we're not saying we're going to need all this staff maybe 2 years from now when things slow down or whatever, who knows? I mean, that's why we do it yearly. But if I think we should try to get the most we can this year, seeing as we have numbers to defend why we're asking for this increased staff. We have substantial evidence that we need a full-time nurse right now. And it's a year-by-year budget, so we're not saying this is going to continue the next 10 years, but for the next year or so, we need a full-time nurse. And
Right.
the story, really. I mean, there's too much to do right now, and this every meeting trying to get another per diem. We can't go on like this. We need a full-time nurse for now.
right. Well, and I think even Nancy, it's a full-time nurse, I think is
And
needed.
more, and
Right.
then some, yeah.
What I'm saying is a full-time nurse is needed indefinitely. It's not just
Right.
for the next year because
No, I know, but I
we're
mean, I think
talking
if we're
about-
gonna try, we should try to get it in now. And then if people want to argue it's too much in a few years, like we just need, I guess I'm just taking it year by year. And I think this year we need a lot more help. Because I don't know a lot. I'm an ICU nurse. I don't know what you and Emily are really, I don't know a lot of it. But I do know that it's a lot of hours and it's very time consuming. And if we're going to do it right, we need the staff.
right. So I would like to make a motion or just talk about, because this is just a draft and we're in discussion, is that we put on now a full-time nurse and a part-time nurse and a per diem nurse. So that way the per diem is really the flexibility, and if really push came to shove, I'm willing to take that part-time to per diem. So, but the full-time doesn't go away. I mean,
Yeah.
it's needed. And so I would say, yeah, 1.5 FTE nursing and a per diem.
Yeah.
Okay,
So Paul?
I can make those changes and I'll get
So,
those.
Paul,
what-
Paul,
what?
That's something you have to bring up. This is now locked. Once I submitted it, it was locked. I can't change anything.
Oh,
What do
That's
you mean
something you'll
locked?
have to talk to Brian and Mark about.
What do you mean it's law?
I cannot alter anything on this,
You're talking on the budget form?
on the budget form, yep.
Oh, on the budget form.
So
Oh.
once it was submitted, it becomes locked to me. I can't do anything to it.
It becomes
So
law?
that's what you have to talk to them
Locked.
about.
So, So we need to, this hasn't been come before the board yet, and you had
That's
to
right.
submit it, so we have to be able to change it, and
Right.
we'll bring that up, Barbara, with,
Mhm.
when we
Okay.
have that conversation.
Yeah. I'll talk to Brian about this tomorrow, as a matter of fact, immediately.
Yeah, because it was my understanding, Paul, we have the right to kind of not do, like, come up with our own budget.
That
Like,
is
I don't-
correct. That is correct. You've done that in the past several times. Every year, it's your budget.
I
It's,
think it's more the software, Nancy. I think,
Right.
I think it's a software issue, and I think we
Right.
can fix that. I don't want to get bogged into that, but,
Yeah,
so, Paul, was there anything else with the budget besides the staffing piece?
no. There were a lot of other items that we added money to, because the fact that we run into, if we're gonna have staff, full-time professional staff, then we don't need to want to get into this problem we had before. We're gonna have to, all of a sudden now, what are we gonna do about a phone? What are we gonna do about a computer? What are we gonna do about this? So we've added in extra money
Oh.
for equipment. Now, it may be that the IT person may say, well, that comes out of my budget. That's fine, as long as it's comes out of somebody's budget. But we're gonna put it into our budget first. Then if it gets knocked out, and if it gets transferred to some other budget, some other department budget, that's fine. But we're putting in a lot of extra for phones, computers, and other equipment and supplies because of added staff.
Right, so think about the number of staff we're adding onto that budget and make sure we have enough for phone, computer, software for those computers, training for those people. And then Emily brought up a good point. If we're going to try to move towards accreditation, are there any fees that are associated with that? You know, I probably have to do a little more homework there to think about that. And that may be the 2023 budget, but we should look at that before we submit a final budget. If there's any accreditation budgeting issues, we need to
Okay,
think
I'd
about.
love to take credit for that comment, but that's Mr. Lit. He put that in.
Oh,
So then, a lot of times I basically gloss over things because I can't get into every line item on the extras. And I didn't mention the fact that we need professional management training. That's ongoing. That's what everybody, our associations, I didn't mention that, but that's I would assume a foregone conclusion that we would also add to that. The same with anything for telephone cost, extra, phone lines. I could go on and on and on, but I mean, it's with all the extras. We'll look at all the extras and try to make sure we cover all the bases.
okay. Are we good to go on to the next item?
Sure. You are? I am.
Nancy, you good?
Yes, yeah.
So next item on the agenda is the Breaknut Hill Davis Farm dump site.
Mhm.
Nancy, did you get the?
Yeah, I got it all here. Yep.
All right, great.
Unfortunately, none of you have had time to probably read all of the addendums or the attachments.
Yeah, there was a lot. I just am kind of perusing it. I know.
Yeah, so I can summarize. The attachments are basically giving you a little bit of the history of what's in the file, what's gone on in the past, because we're basically repeating what went on in the past. Nothing ever came of what went on in the past, but there was an RFP that never went out for bids and so forth. So now my recommendation is that two-page, I wanted to be very brief, that two-page summary of what my assessment was on going out on the site with Melissa Danza, the Conservation Commission agent. And what I found hadn't changed, it just got overgrown. But my recommendation was to go into a three-part phase. One was to do a comprehensive survey of the land, the boundary. The second was to get the trees and brush removed. And the third
Yep.
was to hire up a person that would prepare a comprehensive examination, if you will, of exactly what's under the ground. And then we'd come up with a report for the exact pricing for going out to an RFP pricing like what was done in the past. So that's my recommendation. And that report is to you first, the Board of Health, because that's who I work for. And then it's up to you to decide whether you want to send a copy to the Conservation Commission and to the Selectmen. Now, we gave at the last meeting we had with the Board of Selectmen, I gave an extremely brief report to them. The question came up, of course, is, well, who's going to pay for this? And how is it going to be paid for? And that's good. Again, it's not up to me. That's not up to the Board of Health to come up with how it's going to be paid for. I think that's up to the Selectmen and the Conservation Commission. What I didn't want to mention at that meeting, but I know every year the Conservation Commission has tens of thousands of dollars on what they call community aid, community money, based on the assessment, the tax on land transactions. So there's money there, but yeah, it would have to come out of the town funds. It would have to be appropriated at the town meeting.
So, thanks, Paul, for that summary. And I know we've talked about a lot of this. I guess kind of, Nancy, if you have any questions about this, I would like to kind of make a recommendation that we all the board members review this summary document that Paul created and get Paul any comments. And then as a board, we can send our recommendation to Conservation and the Selectmen.
Okay.
And then see what happens. And as Paul stated, if you go through all these documents, we're virtually doing the same thing that happened in 2005. So in 2005, the land had already been purchased by the town and managed by the Conservation Commission. And there was a review done and a sample to see if there are any toxics in the land. And a report went back to the Conservation Commission, and an RFP was actually at the back of your documents. You'll see the RFP that was actually written to have someone go out and sort of remediate the problem, but that RFP never went out. So
And who was supposed to be in charge of that? The Conservation?
Conservation Commission is sort of the oversight board of this land. And so we're kind of going through the process again and doing the same thing. And so we're going to send our recommendations to them and support them and partner with them in any way that we need to. But Paul has identified that it's not a public health issue. It may be a public safety issue, but really that's not in our purview right now.
Right. Yep.
So we'll
Yeah,
send
it's unfortunate they didn't deal with it then, because now it's probably going to cost significantly more, but.
well, the fact that there's no identified toxins is a good thing. I mean,
Right.
it's really just overgrown land, but you can't use it. Like you can't have walking paths on it or anything because there's a lot of debris that's sticking out. That could be a public safety issue. And so in order for the land to be used for town activities or, town things, it needs to get cleaned up.
Correct.
Absolutely. Yep.
Okay, Paul, does that sound okay to you? So
Yes,
maybe,
it does. Yep.
maybe if you want to write something in a letter form and then send it out to the board, and then we'll get back to you, any comments.
Okay.
And before we send it out, that's great. Thank you
All
for
right.
doing all that work. And if,
Yeah.
as Paul said, there's a folder here in the Board of Health office if you want any more detail, but you pretty much have everything in the packet that you got.
Yep.
All right.
Okay, so next
will
item on the agenda is the trash hauler issue. Paul, maybe you can summarize. I know Nancy's been part of some of the discussion, but not part of some of the other discussions. So
All right.
maybe you can summarize the whole issue around the trash hauler.
Sure. As you may remember, it was briefly mentioned at the last meeting that John Butler, who was on the capital budget committee for the town, that capital budget committee is looking into ways of how can they save the town money and how can they better plan for and prepare for upcoming budget shocks. And one of the things that's going to be coming up is a renewal of the Wheelabrator contract that the town has, which takes care of all the trash that the town produces with residents. And they're a charter member of that group. I think there's about 24 towns in that Wheelabrator. And every 10 years, I believe, the contract comes up for renewal. So the contract is due to be renewed in, I think, 2004 or 5. And so John Butler asked if the Board of Health could help collect some data, metrics. And he said that he found out a eureka moment that he had was that the Board of Health is charged with licensing haulers. So since they're charged with licensing, they can license haulers. Why don't they collect the information that, but he didn't go into too much in the way of specifics with me. Then Sam Stivers on the Board of Selectmen followed up and asked if the Board of Health specifically could use Westboro as a model. They have a very good application form and use their application form and collect information on the 6, 7, or 8, or 10 haulers that haul trash in Southborough. And could we do that? And he realized that there's a lot on our plate and he wasn't going to ask Emily to do it. So it basically fell on the shoulders of others. And so that's to a light degree me, but more particularly probably Barbara. When you don't know where else to put anything, you give it to Barbara. And so if we're going to ask for more hours on a full-time basis for her, whether she could fit this in or not, I don't know. But it would be basically just to license the haulers. But what I did further, because Sam said, I'm going to also send you some material based on regulations that the town of Westboro Board of Health came up with. And I said, oh, okay. So I didn't think too much of it other than when I got the regulations and I started going through them. There's page after page of very detailed information that the Board of Health shall make sure that they collect. And a lot of it has to do with recycling and reduction of waste. And it's, when I talked to the agent over there, he said it's a tremendous amount of reporting that has to be done to the DEP office to show that you're actually reducing your volume. So it's more than just collecting the tonnage, which is what I first thought we were going to be asked to do. Just ask a listing of the haulers and then just collect the tonnage. So I think it involves a lot more. And I think it behooves you, the Board of Health, to look at the regulations. And I sent, did you get those, Emily? I mean, Mary Lou?
I have that, but did Nancy, did you?
I
don't know
didn't
if
get that.
You didn't? Okay, well, we'll make sure that gets out to you and Dan.
Okay.
And then we can follow up at our next meeting in December as to how we want to proceed with this. Now, I'm a little confused and I need to get Sam Stivers because he said they were anxious to get us going on this so that we could have some data to give them by before the end of the year. But I'm not sure why, if the contract renewal Wheelabrator is not until 2024, 2024 or 25. I'm not sure why he needs that now, but maybe it's for planning purpose. It could be in-house planning for the capital budget. I don't know, but I'll find out.
But Paul, the other thing that we need is the report that John Butler talked about. They did a full report of, the tonnage that's going in, the amount of recycling, all of that. None of us have seen that report yet. So I think we need that report. I think we need to review the Westboro regulations. We need to review our current trash removal regulations in Southborough and then see if we need modifications to our regulations. That's going to be a lot more detailed. So
correct. Thank you. Thank you. I'm glad you mentioned that, Mary Lou, because that was something that has been brought up by both Sam and John Butler as the report, and we haven't seen it, so I have no idea what it consists of. But yeah, that's we should see that, and you should see that, so we can make more definitive decisions.
Let's see, Tim's just said something. There is mass grants for solid waste assistance that may help pay for this project. So maybe we could look into that if there's additional funding that may be available, and maybe Sam already knows that, or whoever's, who is like spearheading this? Paul, do you know?
I don't.
Okay.
I called Karen Galligan from the DPW to see if, in fact, she could spread more light on what this is and so forth. And she was not, other than the fact that she knew that there was a contract that would be coming up, but it's not. And she said they had originally come up with some proposals to fix the transfer station, especially the bin that all the trash is dumped into. And
Okay.
so I think they're looking to save money there somehow, and I'm not sure how, whether they can look for reduction in trash. I really don't know. I don't know. I've not been in the trash business. I was years and years and years ago when I worked for the Central Mass Regional Planning Commission. It was one of my among all the other projects. I was in charge of what they call landfills, solid waste landfills and all that sort of thing. And that was back in the 1960s and 70s and early 80s. And after that, I got out of it. I've only been remotely into it when I was involved with the capping for the Boylston landfill and also for the Parkerville Road landfill here in Southborough. That's a different story. The capping, we're not getting involved with capping on this particular dump site. That's a far more expensive proposition.
Sam is on the call. Is there some way to allow him to speak?
I'm not sure.
Someone
Is there an
manage?
IT person that would allow him?
Tim, are you there? I think Tim was running the
Tim
call.
was there? Or
I
Sam?
thought it was-
Tim?
Tim is.
Okay.
Sorry, hi.
Oh,
Can you let Miss Sam Stivers talk?
Yep, give me 1 second, I apologize.
That's all right.
Sorry, I'm facilitating the Zoom call.
Hi, folks. Can you hear me?
Yes,
yes, thank you.
Thank you. Can I make a few comments?
That would be great.
please.
Great, thank you. I appreciate your considering this. Just to build on what Paul was saying. Paul, I thought I'd sent you the John Butler report. If I didn't, I apologize. I'll certainly do that.
Yeah, no, I don't have John Butler's report.
Okay, I'll do that. And if you could forward it to the rest of the board, that would be great. John's work was generated, as Paul said, by the Capital Planning Committee. DPW had asked for about $3 million in the capital budget to redo the transfer station, including rebuilding the trash pit and reconfiguring the recycling area and so forth. And Capital Planning Committee said, do we really need to do this? And they asked John to take a look at disposal, recycling, et cetera. The answer came back, simple terms, no. We can keep the current system going indefinitely by maintaining it. It's not, modern state of the art, but it works. And so we absolutely don't have to spend the $3 million. But he said he realized that we've got a big contract renewal coming up, and I think it's a 20-year contract, Paul. So it's something that you need to get right because the disposal facilities, Wheelabrator, they want to do a longer term contract. And so if we don't have the right data to negotiate carefully, then we are in a much worse position as far as getting right pricing and so forth. John looked at several surrounding towns in terms of how they do this business. And the good news is Southborough is actually in very good shape relative to surrounding towns. If you have a situation where most of your trash goes through your transfer station to your hauler, you get much better economics than other towns. Either Sudbury or Wayland, I can't remember, has a transfer station, but they have a very small portion of their trash going through that facility versus through private haulers. That's a fixed cost, and it makes it very expensive to run that program. So we're trying to do things that make the economics better for our citizens. Costs us about $275 a year for a resident to use the transfer station. go through all the numbers, but that's the bottom line on it. If the people use a private hauler, it's at least $400, maybe as much as $600. And there's a value in convenience, certainly, but it's good for us to know the economics of the business, and we're in much better chance of coming up with a solution with Wheelabrator that keeps those economics favorable for us going forward. And so John's point was simply that we don't know the volume from the private haulers. Other towns who do the licensing and the permitting get a report from the private haulers saying this many tons comes from us, from Southborough residents into our facilities. And that way we can have a better idea of how we want to talk with Wheelabrator in terms of the volumes that we can project for them and get better prices. And so that piece of data, and it's about, I think about a third of our trash goes through private haulers, something like that. I can't remember the exact number, but if we get a better fix on that, it puts us in a better negotiating position. Paul is correct. It would be great if we could get this done by January 1, but I've continued to emphasize, I know you guys are extraordinarily busy these days, and so we want to get it done, but not at the expense of the other important work that you're doing. So if there were a way to get it done, that would be great. If that's not possible, then we can think about some sort of a different phasing for timing and so forth, and when we could actually start sometime next year and have a part year for the first year or whatever. Paul raises an interesting question about the DEP reporting. I went through and I looked at the language in the Westboro regulations, and I didn't see a lot of reporting required to DEP in there, but certainly something that we need to figure out and understand before we go forward. But in terms of the work for the Board of Health, if you look at the application, we've got to do a variety of things like identifying the haulers and communicating the requirements with them, answering questions that they might have, review the permit applications and collect application fees, issue permits. And there's some maintenance things that the Board of Health becomes the appeal board if people, private haulers reject trash from residents because it's got the wrong stuff in it or things that you're not supposed to dispose. Board of Health technically is supposed to assist with enforcement and reviewing and adjudicating complaints that people have, et cetera. And ultimately you'd have the right to inspect trucks and loads as may be necessary and manage enforcement and hear appeals of penalties. So the administrative stuff that you might get involved with is there. Certainly not clear how much work that is from a bottom line standpoint, but we could certainly talk to Westboro and sort of hear their experience as far as do they get one appeal a year or 20 a month kind of thing, et cetera. So there's data out there that we could look at, and again, reinforcing the Board of Selectmen is interested in doing this. This is clearly your purview as an independently elected board. You can choose to do it or not do it as you think makes sense. But the Board Selectmen is interested in trying to do a good job in terms of this negotiation coming up with Wheelabrator. And this data could be very useful for that. So that's the basis of the request here. And I have some questions for town council in terms of what it is you folks need to do if you do decide to move forward with this, relative to you need to vote to adopt certain portions of state law, or can you simply just issue regulations as you see fit? So
Sam, yeah, I think that's more sort of the overarching right now. That would be the first question, because we need to look at what our current regs are around trash removal and what's in there, and then what regulation changes need to happen before just issuing a license. That would have to go to a vote. I think we all want the same things to move in the right direction. And it's going to depend the depth of the reporting that we need. And
right.
So I think we have some things that we need to iron out before we can move forward. But I think we're all in agreement to move in the right direction.
All right, great. Thank you very much. And again, I don't think, Mary Lou, that there's a lot needs to be done relative to our current regulations, which focus on trash that our citizens take to our transfer station. This is a separate issue. This is private haulers who aren't taking trash to our transfer station. So in theory, I think we could implement this without having any real impact on our current DPW transfer station regulations. But again, there are a number of questions here that everybody needs to understand completely before we move forward. And I mentioned to Paul, by the way, you folks may have heard, Board of Selectmen is in the process of appointing liaisons to different departments, and each of us is supposed to work with several departments. And it looks like I'm going to be the liaison to Board of Health, which I applied for, and delighted that I was appointed to that. And I'm interested in pursuing the blueprint for expanded function in Board of Health. Frankly, that was one of the reasons that got me interested in that. So I look forward to working with you on that. And the trash hauler thing is another thing that I look forward to working with you. And again, hope we can find a way that works for everybody, but ultimately it's your decision. So I will continue to investigate some of this stuff, and I'll send the materials to Paul. Paul has all the regulations now from Westboro, and I'll send Paul again the John Butler report, and look forward to being able to answer any questions that you have going forward. So thank you.
Great.
Great.
Thank
Thank you,
you.
Sam. That was really helpful. And we look forward to working with you too. It's great to
Yes.
have a liaison that, sometimes we feel like we're just sort of hanging out there on the side, as the Board of Health, and not as involved in all of the town activities. And so it's really helpful to have.
I think you're the center of the universe now for a lot of reasons.
Well, all of a sudden there's a light on us, and it's like, okay, that's probably a good thing. But no, it's great. And the outcome will be improved services, hopefully in the end. So that's all we want.
It sounds great. Thank you.
Thank you.
So I think we did good getting through everything. We're now down to other business. Paul, I didn't know if there was anything else that.
No, that was it. I was glad that Sam was able to get on, because he did talk to me, mentioned that he was going to, it was a new thing. They're going to be having liaisons to the different departments and boards. And I'm glad he brought that up, because I would have forgotten to bring that up. So that's a good thing. And I'm glad he mentioned that, but I don't have anything else.
I have one thing, if it's okay to bring it up.
Sure.
I just had someone sent me, and I forwarded it to Emily today. It's actually a neighbor of mine, but he sent it through the town website. So just basically, what's the best place for people, small businesses, to look? Like what website, or the state, like where is the best place to get the information on what they should be doing in the workplace, do you feel?
For COVID.
For COVID.
Okay. Yes, I can put that in the minutes to this. There is a state website that it really details small business, and it actually goes into detail on the type of business and what you need.
Because he said I didn't really have time. I just noticed this email this morning. It was actually from last Tuesday. He just said there was different things he was seeing in the media than what it was saying on the state website, but go by the state website is what he should be doing.
Oh yeah, state website versus media for sure.
Right, I figured as much, but I didn't know if there was somewhere else. I just want to make
Emily,
sure
are
I'm
you
giving the right
okay?
information.
Emily's been, and when business in town call Emily, she'll walk through if they have specific questions about specific things. Are you okay with that, Emily?
Yeah, and I did see the email. It was about mask wearing.
Yeah.
And I do think now that we've had layers upon layers of change, in the regulations and recommendations and orders. It is sort of difficult to navigate the mass.gov and try to find what the latest is, because oftentimes I'll Google something and search in the mass.gov search bar, and it throws me back to something that was written in May, when I know that there was something written in like August or September to update.
Right. We would hope.
So, so that last week, the new mask order came out, and I personally still have questions about it. My understanding initially was you should be wearing a mask every time you're anywhere that you're not with your immediate family. But it was more specifically addressing outside in the public. So if you're out anywhere that you might see anyone, even if you're maintaining a 6-foot distance, you should be wearing a mask. But his question was specific to within an office building. And I think that
Right.
if you're in a separate office with a door, then you don't need a mask. But if there's,
This
you know-
was cubicles that are 10 by 10.
right. And it's unclear to me still, so I'm still trying to iron out what they really are saying with the new mask order from last week. I don't know if anyone else read it in detail, but it's,
Emily, can you follow up with that person?
of
That
course I can.
town? That would be great. So once you do your, figure out specifics and you can get back to him, that would be great.
Mhm.
And I'm sorry to add more to your plate. I just,
No. Those,
You know, I
those
wanna make
questions-
sure they're
those
doing- I mean,
emails come to me too. That one,
yeah,
but there's, I don't know what field they choose to who it goes to,
yeah, I
how
don't
that's
know.
set up, but I do get some every week
Yeah,
requesting a call or reporting something. So,
Ugh. And it's almost easier like to work somewhere where you just have to wear a mask because it's, just, you're so used to it by now, I guess, but.
I wear mine all the time. I'm home right now, so I'm not wearing it, but
Right, same.
Okay, thank you,
Yeah.
everybody.
Great.
Thank you.
Meeting adjourned. I
all
have,
right.
I have 1% on my computer, so we lucked out.
Woo!
Okay,
All
signing off.
right.
All
Stay
right.
healthy, stay sane.
Thanks, Sadie. Yep.
Thank you.
All right, bye.